This question's from the June 2011 paper, GCSE Edexcel specification. The question deals with the topic of performance enhancing drugs, so not looking at recreational substances but those which aid performers in the world of sport. One of the benefits of this type of question is that candidates are actually given some support in their answers by being provided with a word box or a comment bank. This helps students in their recall knowledge because they don't have to recall the different categories of drugs because they're provided for them by the examiner of the exam paper. In terms of the types of questions we get for performance enhancing drugs, they are generally around these few topics. Which drugs are taken by what performer? What are the perceived physiological benefits? What are the harmful side effects? And then the moral dilemma as to why is it that performers with so many risks would still consider taking these substances. So let's have a look at the first question then. Question A to A, part 1, asks us to use the information in the box to identify whether long distance runners are more likely to use this class of drug than sprinters. So what we want to be able to do from this is first and foremost identify which substances might be taken by sprinters. So we know that anabolic agents are taken to improve power and growth within performers, enabling them to train harder. We know that stimulants aid speed of reaction time and increased alertness. We know that beta blockers are to do with slowing down heart rate, and we know that diuretics are to do with weight loss. That leaves us with probably the hardest question to do first and foremost, in the fact that we're left with two categories where the phraseology and terminology can quite often put students off. We are quite fortunate at the moment in that the recent Lance Armstrong trial with regards to an admittance of drug abuse has brought EPO into the forefront, and having admitted taking EPO erythropoietin, we know that this is a substance that therefore aids cyclists. So if this is a substance that aids cyclists, then there's a good chance that this substance will also aid long distance performers. So what we're going to go for in 8A part 1 is we're going to go for peptide hormones. Students shouldn't be too worried about making errors in terms of spelling because they're given the words in the box above, so it's just a case of copying them incorrectly. If we go to A part 2, weightlifters may use this class of drug to mask the pain of a torn muscle. We're after a substance here, therefore, that doesn't do any remedial help in terms of improving the injury, but what it does, it masks the messages sent from the injured area of the body to the brain and prevents those arriving. So the consequence of that is that the injury can still worsen through physical activity. The category that we identify here, which includes examples such as codeine, are narcotic analgesics or painkillers. As we move on, part 3 asks us to look at the class of drug which helps improve accuracy. So we're looking at a substance which aids golfers, snooker players, dart players, archers, pistol shooters, where accuracy is one of the key benefits to their sport. What we've identified there is that we're looking for a substance that doesn't excite a performer but actually calms a performer down, and that substance or that category is beta blockers. The last part of the question that is related to the word box asks us to look at the class of drug which is used as a masking agent. So if performers take some drugs, then they actually take a supplementary substance to try and mask the fact that this drug has been taken so it's not picked up in a test. There are some substances that are taken to actually help flush the illegal substance through the body system at a quick rate, therefore to avoid detection. So we're after a substance that actually helps increase the fluid rate through the body and helps flush through the body systems. We know that one of the substances identified for weight loss and weight loss via fluid loss is diuretics. which is the correct response for the fourth question. Part B goes away from identification of substance and deals with the moral question, and there's a selection of responses that candidates could choose from. We'll identify some of the popular or easier ones that they could actually go for in terms of this question. So all of the drugs have harmful side effects, so why is it then that some performers will still use them? Most obviously the candidates will think of extrinsic gains, so they will think of things such as success. With success often comes sponsorship or endorsement, and may appear medals. So that's the monetary gain that more than likely drives most performers to wish to take an illegal substance to help them increase their own performance. They could, however, allude to the fact that they're under pressure from significant others to take them, such as a coach, or they could actually just agree that they have a poor natural ability and consequently require some other way other than training hard to improve that natural ability to be able to become one of the better athletes in the world. Moral dilemma to help you with this question might be if you could be given a substance that is untraceable, makes you the fastest male or female on the planet, but gives you a life expectancy of 30 years only, would you still take that substance? And if you ponder that amongst your friends as an activity, then it will certainly help you come up with some extended responses to part B. The last part asks us to look at the harmful side effects. So tied into this moral dilemma, what are some of the harmful side effects? Well, we've identified earlier that diuretics are to increase fluid removal from the body. So the most obvious side effect for this is going to be dehydration. There are other effects such as kidney or heart problems as a result of it, and nausea and sickness as well. But dehydration is probably the most relevant and easy to remember. So to summarise these questions on performance enhancing drugs, are you able to classify in your own mind or in your own notes what the 6 categories of performance enhancing drugs are, and they're identified in the table? Can you identify which performers would take what substance? Can you identify the physiological reasons as to why? What are the advantages? Can you also identify some of the side effects for each of the substances? And maybe explain why performers will still risk, in knowledge of these side effects, taking substances to improve their own performance.